You've had surgery, you're motivated, you want to recover fast. So you push, you stretch harder, you do extra reps, you fight through the pain. And that right there is the worst mistake people make after joint replacement. I'm Dr. Tyler Goldberg, an orthopedic surgeon in Austin, Texas. Over the last 25 years, I've performed over 12,000 hip and knee replacements. And today, I'm going to explain why trying to recover faster often is the very thing that slows you down. The worst mistake after hip or knee replacement is this: trying to dominate recovery instead of respecting it. Patients think, if I push harder, I'll heal faster. That logic works in the gym. It doesn't work in surgical recovery. After joint replacement, your body enters an inflammatory phase. Inflammation is not an enemy. It's a healing process, but inflammation has limits. And when you overstretch, overbend, do aggressive therapy, and kind of ignore the swelling, you're gonna increase inflammation beyond what the body can regulate. And increased inflammation is gonna lead to more swelling. It's gonna lead to more pain, more muscle inhibition. It's gonna lead to stiffness, and you're gonna feel like you're doing more, but you're actually slowing the tissue recovery system. After total knee replacements, swelling inhibits the quadriceps. This is called arthrogenic muscle inhibition. If you aggressively force flexion in week 1, swelling will increase. More swelling means less quad activation. Less quad activation means more limp and slower progress. After hip replacement, especially the type of hip replacement I do, anterior approach, aggressive overactivity can irritate your hip flexors. It'll irritate the joint capsule and surrounding soft tissue. That's going to create more groin pain. Patients then worry that something went wrong, but in fact, nothing went wrong. You just exceeded what healing tissue could tolerate. So why do people do this? Well, it's about control. You couldn't control what happened in the operating room. You can't control the way your body heals. So now you try to control the recovery. If the therapist says do 10, you're going to do 20 because you doubling the reps must be better, right? You stretch past the discomfort. You take an extra pain pill to squeeze a little more, right? You change the range of motion milestones. But recovery is not a competition. It's a sequencing process. Early recovery is about swelling control, gentle, consistent movement, proper activation. It's about getting sleep. How about that? Your body is going to require sleep after you've had major surgery. And early recovery is about nutrition. Consistency will beat intensity every time. Patients who recover best are not the most aggressive. They're the most disciplined. Let me tell you a story about range of motion on a knee. So one time I did a knee replacement on this lady, and she has a stroke after surgery. She is in the ICU. She's in one of those roller beds. I'm thinking she's gonna pass, right? I talked to her family. They talked to me about, what they're gonna do with her estate, blah, blah, blah. It looks dire and she's gonna pass. So you know what? I actually kind of signed off and I didn't see her for months. And then one day she walks into my clinic and she's got 125 degrees range of motion. At first I was like, I thought you were dead. Like, I can't believe it. She's like, nope, I made it. And I was like, how did you get that range of motion? And she said, I had a stroke. I didn't do anything to get that range of motion. I'm like, you just let your body heal and it did that for you? And she's like, yes. How about that? Sometimes if you allow the body to heal, it will do what it wants you to do. So what about that range of motion? Patients panic oftentimes when they don't hit 90 degrees by 2 weeks. They want 120 degrees by week 4. Milestones matter, right? But forcing them too early causes setbacks. Think about that patient I just mentioned. Swelling is going to block your motion. Reduce your swelling and motion will improve naturally. So here's the mindset shift that you need. Instead of asking, how fast can I push this? Ask yourself, what does healing tissue need today? Because some days that's movement and some days it's rest. Both are remarkably productive. There's a time to increase intensity. That's usually after inflammation starts to stabilize, your swelling starts to decrease, and your baseline strength returns. That timing varies by patient. We all don't work on the same script, but it's rarely in week 1. If you're in early recovery and you're unsure whether or not you're pushing too hard or not enough, I built a simple 2-minute joint pain quiz that helps clarify where you are in the process. It's in the description below. Clarity prevents unnecessary setbacks. So what about the bigger picture in this? You can have a technically perfect surgery and sabotage recovery by misunderstanding healing. Joint replacement recovery is not about heroics. It's about discipline. Healing is biology. Biology has a pace. You have to respect that. And you'll recover faster in the long run. I'll see you in the next video, and I hope that helped.